Alright, I just want to show you this case. Let me set the background for you. This is a PET scan done on a patient with lung cancer. So essentially, a radioactive tracer is attached to a glucose molecule and is administered to the patient. And then about an hour later, the patient is imaged, and wherever the glucose goes, it'll show up as bright on these images. And they actually fuse the image with a CT as well, so you can see anatomically where the signal or the activity is coming from. And glucose will go to sites of metabolism. So let me just show you quickly. There's the lung cancer. But that's not why I'm showing this case. So one thing I noticed when I was looking at the CT scan, look at the upper left corner here, and I noticed that on the patient's left, let me scroll to it, you have the condyle right in the mandibular fossa where it should be. But on the patient's right side, let's see if I can get it. See how the condyle is kind of anterior? It's not centered within the glenoid fossa. And I thought that was kind of interesting. This patient, you can see, has no teeth. And subluxations or dislocations are very common in patients without teeth because they don't have a reproducible bite. So you don't get the same muscle memory that people with teeth have, where the teeth fit together nicely. It kind of provides a nice stable position, and the muscles just tend to bring the jaws into that position. But the other reason to have a subluxation is if you have abnormal activity of one of the muscles that opens the jaw. And the main opening muscle of the jaw is the lateral pterygoid. So on the left side you have the lateral pterygoid muscle that attaches to the lateral aspect of the lateral pterygoid plate and attaches to the condyle. And then take a look at the one on the right. It's got a bunch of activity in it. So for some reason, the patient's right lateral pterygoid is very active. It could be in spasm or just be hyperactive. But you can see all the glucose molecules that were attached to the radioactive fluoride went to that lateral pterygoid muscle. And that corresponds to the anterior subluxation on CT. So there's in the upper right hand portion of the screen, there is the normal left condyle. Let me see if I can scroll over. To the other side. Let me click off of that so you can see it. And here is the patient's right side. So you can see that condyle is anterior and translated down the articular eminence here. Let me show you the articular eminence in a little better detail. There. Okay. So some patients have chronic or recurrent dislocation. This is, again, not a dislocation because it's not in front of the articular eminence. It's just translated down. And some of the treatments for chronic dislocation or recurrent dislocation, a couple things you can do. You could make this eminence longer so that it's not possible for the condyle to go in front of it. You can make it shorter so that if it does go in front, it can easily slide back. Or if the thought is that it's occurring because of a spasm of the lateral pterygoid muscle, you can either do a lateral pterygoid myotomy and cut the muscle, or inject Botox into the lateral pterygoid muscle. So again, this case, this PET CT was ordered for cancer. It was not ordered for this purpose at all. This was a completely incidental finding, but I just thought it was interesting that this patient had a subluxation of the right condyle and increased fluorodeoxyglucose uptake in the right lateral pterygoid muscle, probably reflecting either spasm or overactivity that is leading to the subluxation. So one more finding on this case that I want to mention. Take a look at the left maxillary sinus. So sinus disease we see all the time. You can see on the patient's right side there's mucosal thickening. So paranasal sinus mucosal disease is nothing new. what's new here, or what's different, or something to make note of, is that this left maxillary sinus is completely opacified. Again, could be just simple maxillary sinus disease, could be inflamed mucosa and a little bit of fluid. But it's a little bit bigger, and it's possible that the bony walls are a little bit expanded. And so when you see this, you want to at least think about a mucocele, where there's obstruction of the drainage of the sinus and you get secretions that build up and exert pressure on the walls of the sinus, leading to expansion. And this can lead to upward lifting of the orbital floor and can actually cause significant remodeling of the bone. I'm not sure that's what's going on here because the expansion is somewhat subtle, and it's possible this patient just had a larger sinus on the left that is full of stuff. But again, when you see a completely opacified sinus, it can be mostly opacified, but when you see a completely opacified sinus, you really want to look for any expansion of the walls and suggest the possibility of a mucocele. And that's it.